All right, so I just want to start with just mentally for kids in dealing with this pandemic. Have you heard parents maybe struggling to explain to their kids just kind of what's going on and the gravity of what we're really dealing with right now in our country?
Yeah, so there's a difference between kind of what we're hearing nationally and what I'm seeing locally. So, I see kids in my practice. I have, families that I see, and really, the people I've actually been talking to locally, everyone's kind of doing okay. I don't think that we've really hit our peak here. And so I think a lot of people are nervous. They don't really know what to make of all of this. They can't really wrap their mind around it. But for the most part, kids are doing okay, the ones that I've seen.
How important is it to be able to talk to your children about what's going on and this pandemic, to be able to connect with them emotionally if they're struggling right now with something?
Yeah, and so that's really a case by case basis for each family to kind of address. And each kid is different, and every parent and child relationship is different. But if a kid is struggling, absolutely, the best thing to do is based upon kind of the age of the kid and how much that they can understand. And parents usually have a good sense of this. You want to try to kind of be straightforward with them, tell them what's going on. But also, some positive things about this coronavirus epidemic in terms of kids is they're really not at high risk. So they don't have a lot to personally be scared of. But there is, some concerns that they have, a loved one getting sick and being off of school and things like that. And that's kind of really the approach that we took with our kids.
From a perspective of a parent, because I'm somebody who goes through therapy, and I'm somebody who's had some trauma from my childhood where I was raised that have kind of played a part into some of the aspects of my life that I struggle with. How important is it right now for parents to be there emotionally for their children to make sure that there's not this long-term traumatic effect from what's going on right now?
Yeah, it's it's super important, depending on the relationship that which you have with your kid. And like you said, there's a lot of families that struggle, and not to get into the details of that, but parents are trying their best, kids are trying their best, but sometimes there's a mismatch of the way that people think about things, the way that people relate to each other. But in general, yes, it's very important to sit down and try to take an opportunity to see where your kids are at, because you don't want to try to guess. You want to kind of have a conversation and see if they'll open up and kind of tell you what they're worried about, what they're concerned about, and then you can kind of address those concerns and kind of let them know, what they should be worried about and what things that they shouldn't be worried about.
What is the best way, in your opinion, to talk to your kids about, what's going on and the pandemic and maybe some of the strengths and some of the stress that it's putting on the family, whether it be financially or whether it be emotionally? How important is it to talk to your kids, and how do you do that?
Yeah, so that's a great question. And I think to give some practical advice, first of all, you got to start with the age of your kids. And if you want to divide it up into kind of three categories, you got young kids younger than 8, kids that are about 8 to 15, and then kids that are older than 15. Obviously, the young kids, you want to keep things very simple. You want to say that there's something really important happening right now, and a lot of people are getting sick, but don't worry, you're going to be okay. Mommy and daddy are doing what they need to do to kind of stay safe. And so, just kind of talk through what's going on with them. Obviously, if the kids are between, 8 and 15, you're going to have a little bit more detailed conversation with them to let them know a little bit more about what's going on, kind of assess where they're at and what fears they might have. But again, reinforce that they're safe and that everything is going to be okay. And then 15-year-olds and older, you're going to have a much more in-depth conversation and probably have to answer some more difficult questions. But again, people's situations are different. There are some people that are very low risk. They're able to, stay home, work from home, and, maybe not at medical risk. And so it's very unlikely that the coronavirus is going to affect them as much. And then you look at other people, they may have lost their job. They might have significant financial stress. They might have an older loved one at home who's at high risk for having severe complications. You might have a parent who's a healthcare worker and is literally going in to battle each evening. And so those conversations are going to be a lot more difficult. But I think in general, people need to remember kind of what age they're talking to, and kind of breaking it up in those three age groups is helpful sometimes.
As far as kids that are having to do schooling online now, this is a totally different way for them to to learn. I mean, they're not going to be in a classroom right now, at least for the foreseeable future. They're going to have to connect with their teachers virtually. That may be causing some of them stress as well, and potentially falling behind. So what advice do you have for parents to kind of chat with their children about that to make sure mentally they're okay in that space?
Yeah, so I've done a lot of reading on this. Obviously, my own kids are doing online schooling, and I've talked to a lot of parents and kids in my practice who are going through this. And I think that the best thing to remember is that the goal of the rest of this year is to make sure that they can learn as much as possible, so that they don't fall behind and they can kind of continue it with their grade starting the next year. So, the normal kind of competitive schooling that's out there, like I have to get good grades so that I can be prepared to do well in high school and be prepared to go to college and things like that. I think a lot of that has gone to the background a little bit, as it should. And so I think, kind of setting the tone for what the expectations are. Like, so for my kids, we talked about, hey, I want you guys really to log on and try to learn as much as you can. Okay. It's not about doing well on the test per se, or getting, the A's or B's that we expect normally. I want you just to really focus on learning the material so that you can kind of stay caught up. And that's really what I've heard from educators too, is that we're just trying to keep our kids on track right now. And so I think taking that approach is a little bit more helpful instead of kind of the normal stress that you can get with schooling. And I'll say that there's actually been a lot written about this recently, about how some kids, and I've seen this in my practice a little bit, I saw a 15-year-old by a telehealth appointment today, whose mom and her saying this is the best she's felt in a long time. She's just doing virtual school from 8 to noon, and then she doesn't have a lot of the social pressure that she's had at school. And so she's adapting well to it, where some other kids may not be adapting well to it. So, again, like we've been saying, every situation is a little different.
That's interesting too, because the social pressures, I mean, you're not getting bullied when you're in your home, or you're, studying from your dining room. How does that play into effect? Because there could be some positives, as you mentioned, to this, of kids being able to learn from home, as they don't have to have some of those social pressures that come with going to a physical classroom or school. Yeah.
And actually that's what I've been seeing. And it's so surprising, because really, we don't really have any frame of reference for this in mental health right now, because, the thing about mental health that makes it kind of easy to practice after you've been in practice for a while is the way that people's, psychology goes astray is pretty predictable. But we're dealing with something that as mental health professionals, we've never dealt with before. So, I can't predict what's happening. And so I've been somewhat surprised by the reaction of some of my patients. I've checked in probably with at least 2 or 3 today over telehealth appointments, and everyone's just kind of like, yeah, I'm doing okay. I've been kind of practicing for social distancing my whole life. And, I'm kind of doing okay with this, but who knows what this is going to look like in 3 weeks, 4 weeks, another month. And that's what we have to be prepared for as mental health professionals. And I've had a lot of conversations with colleagues about that.
Do you fear a little bit of a emotional distancing, or maybe that, because there's a lot to be said about being able to physically meet up with people, or have a contact, one-on-one, or be able to connect with someone face-to-face? Do you fear that there could be some long-term ramifications of this for our kids not being able to have that interpersonal communication?
Yes, for kids and adults, I'm concerned about that. Especially, you look at some situations where a kid's home life may not be the best, and maybe they're even an only child. So, there's a lot written about this in psychotherapy literature about how, if the home life is disruptive, if you go to school and you have predictability, you have teachers, you have friends, there's, some benefit to that. And you're actually able to kind of dissociate out the negative and just keep the positive and continue to grow and mature in that way. And so for some kids who don't have a great home life, missing school could have a very negative effect for them. And the opposite is true too. If a kid has a really good home life and school is where the stress is, being home more often might have them doing a little bit better.
Is there ways that parents could help here in this scenario? We mentioned being able to talk to their children, but are there any tips that you can give parents to be able to connect with their kids, especially during a time like this, in the situations you mentioned? Maybe they have a great home life and it's not great at school, or vice versa. What advice do you have for parents in being able to right now to connect with their children?
Yeah. So if you look at the parent situation, hopefully the parent's in a situation where they're not too overstressed themselves. And that's one big point. I've been doing, a lot of interviews and a lot of other stuff at this time. Big demarcation. If either the kid or the parent is having significant problems, they really need to seek professional help. Every colleague I know in mental health right now, their practice is still open. So even if you don't have a history of mental health, we're in unprecedented times right now. So if there's severe problems, need to get professional help. But beyond that, trying to find a time to connect with your children and have a conversation with them and try to get them to open up. If that's not something that you're good at or used to doing, you don't want to force it, but just like taking a moment and whatever they're doing, just kind of going and sitting and kind of being with them in that activity and finding some things you can do together, even if it's taking a quick walk or going outside and throwing the football or something or another, activity outside. And in the activity, being able to start talking and connecting a little bit. That's usually something that works well. And we all have a little bit more time on our hands now.
Just quickly on parents and those that may be emotionally dealing with a lot of stress right now that they didn't anticipate their way. They're either, getting their hours cut, they've lost their job, their finances aren't in the shape that they wanted them to be. They're on the front lines and they're certainly worried about, this disease and potentially, the spread of it. What can you do, or what advice do you have for those older adults that may be struggling right now with some of their emotions and have, may mentally be in a place maybe they don't want to be?
Yeah, a couple tips that we've kind of come up with, some very practical things. First of all, monitor yourself. If you're not sleeping at night, if you cannot calm your mind down, if you're super anxious, you can't function, again, go look for some professional help. One great website is psychologytoday.com. You can put in your zip code and it'll give you every therapist and psychiatrist in the area. And you can do filters for your insurance. So seek help if you need to. If you're sleeping okay and you're kind of hanging in there, some practical tips: try to eat well, try to get a little bit of fresh air outside, turn the news off, make sure you stay connected, make sure you know the information that's happening. But if you're sitting there watching an hour or two of news a night, or you're constantly in Facebook or Twitter or whatever social media you're in, you're going to hear the worst stories over and over and over again, and you're going to have a negative bias in your thinking. I'm a professional and I catch myself doing this all the time. And I will see my own mood change by sitting there and watching an hour or two of news versus going outside with my kids for a little bit. You need to stay informed, you need to stay responsible, but you also need to disconnect a little bit. And that's probably the best piece of advice I can give.